My name is Amy Simpkins. I'm speaking to registered nurses at a clinical care conference. Let me first just start by telling you a story. A new nurse who's on orientation in the unit, working with the charge nurse, she's getting her tour, but she notices something peculiar on the unit. She notices that the doctor that's there, the house doctor, he's randomly shouting out words like tetanus, flu, morphine, hepatitis, polio. Well, of course, the new nurse is puzzled, and she looks at her charge nurse and says, "What's wrong with him?" Well, the charge nurse just shrugged it off and said, "Don't pay attention to him. He thinks he calls all the shots." Okay, well, that was a joke, obviously. And maybe I'm not the best at telling jokes. So why tell one? Well, because the chances are that even if you didn't laugh, maybe you smiled, or you shook your head, maybe you rolled your eyes, and maybe you were smiling on the inside. But either way, whatever the case may be, it was evident from your perspective that it was an effort to make you smile. So what's my point? Well, the whole point of my discussion is laughter can be good medicine. According to Jay Gottfried of the Journal of Women's Health, he goes on to say in his article that studies support this statement, that laughter in areas of medicine such as cardiac rehab, in pain management, this coping with discomfort, stress on immune responses, all of these can be benefited by employing laughter. In fact, Dr. Goodman makes these comments. He says, "Having a sense of humor can help people deal with difficult situations and goes a long way to with a positive attitude as part of a self-fulfilling cycle." So we get back what we give, essentially, is what he's telling us. Also, Dr. Fry made the comment that humor is the tonic that any patient can afford. So they don't have to be charged for that, do they? But so much are they recognize now the benefits of humor in medicine that in a lot of pediatric hospitals, they implore the use of clowns. So when a child is going through a difficult procedure, maybe getting a blood draw, or maybe getting even a cancer treatment, they have clowns there to lighten the mood or to help the child cope with a stressful situation. And not only does it help the patient, the child, but it also helps the parents because they're struggling too. No one likes to see their child suffer. So it's obvious then that it's used in a pediatric level, but as these studies that we've looked at show, it's also the adult population can benefit as well. So obviously, though, we're not comedians, or at least most of us aren't. So we need balance too, and we don't want to make light of someone's bad diagnosis. If someone gets a diagnosis of cancer, we don't want to make a joke about it, or we obviously have to use a good deal of tact. But it just helps us to appreciate that when we have the opportunity to use humor as part of our practice, that we should make opportunities for that. Because as nurses, we recognize that we treat the whole person, mentally, emotionally, physically. Our goal is to get them to their best health in all those capacities. So if we can implore some humor as part of our medicine, then we should do it. Well, how do you incorporate that, you may ask? Well, Dr. Gottfried gave some suggestions on how we can do that, because obviously, like I said, we're not all comedians. We can regularly take in funny films, joke books, watch comedians, browse through humor sections of a bookstore or library. We can read the cartoons in the newspaper. Certainly on the internet, there's a wealth of funny, crazy, silly things that we can share. And even expose ourselves to different types of humor. We may polarize ourselves liking a certain kind, but trying different types of humor, we might find that our patients prefer that. So bottom line is, we don't have to be comedians, but studies have shown how much our patients are benefited when we can employ humor. It helps their immune response, their pain threshold. It alleviates some tension, and also for the families too, because we really are benefiting others. And when we do these things, we're really paying it forward. We hope to reap back as well. So in conclusion, the bottom line is, let's leave them better than we found them. You can do it.